Hello, Parenting Genie family followers out there. Constance here again, Wednesday night, 6 p.m. in Melbourne. Hope you're all well. We've got cooler weather here. It's autumn and it's lovely. Now, tonight, the topic that I chose is smoking and breastfeeding. Now, in Australia, there's not that many breastfeeding mothers who smoke. I don't know what the rest of the world does, but I do come across some mothers who want to quit smoking or they want to quit breastfeeding because they're smoking. And so tonight I would like you to understand a little bit more about the impacts of tobacco smoking and breastfeeding. There is a lot of publications online that you can read up as well, but I just fill you in with things that I do clinically or that I've come across to, or what are things that I would advise mothers and parents to do. Now, what is the impact of tobacco smoking? We know what the impact is in pregnancy. It certainly can affect the pregnancy, but it can also affect your own health or my health. If I smell passive smoke or inhale passive smoke, that would give me health impacts. Now, the first thing that comes to my mind, obviously, is that smoking affects the baby's lungs and can also affect their breathing. There has been association and also research to a higher amount of lung infections, respiratory problems, also problems with the ears, like more ear infections. There are issues with diarrhea. More colic is reported in babies whose mums smoke. And of course, there is the link to sudden infant death syndrome, which is quite clear that that risk is increased when babies are exposed to tobacco and to nicotine in the breast milk. However, there's one statement that I have to be very clear about today. It is safer for your baby to breastfeed whilst you are smoking, or maybe not whilst, but being a smoking parent or smoking mother, than actually to formula feed. So remember that. If you can't quit or you feel it's too difficult to quit and you want to continue breastfeeding, it's safer for your baby and healthier for your baby to be breastfed during your time of smoking than actually not being breastfed and being formula fed. So that's really important. So how can we reduce nicotine exposure to the baby if we are a smoking parent and we can't quit? Or maybe sometimes we don't really want to quit because it is really important for our mental health to every now and then have a cigarette to smoke. First of all, breastfeed your baby before you smoke. Nicotine levels in milk and blood drop after smoking. After 90 minutes after a breastfeed, the nicotine level is half of what it would have been beforehand. So it takes 90 minutes to halve the level of nicotine in your breast milk after a breastfeed. So by the time you breastfeed again, there won't be too much nicotine in your breast milk. Keep your house smoke-free. Have an outside smoking area only. keep smokers away from your baby. So if you have other relatives who smoke, try to keep them away from your baby, certainly with cigarette smoke, but also if their hands are full of nicotine, or their breath is full of nicotine, or their clothing is. If you need to smoke or you can't quit, use a smoker's shirt or cardigan or coat. That means that when you need to smoke, you go hopefully outside and you have a special pair of clothing, like a cardigan that you put on. And then when you go inside again, you take that off, because the nicotine is also laid down on your skin, your hair, and on your hands and your clothing. So you reduce the exposure of nicotine to your baby by changing your clothes. Other measures to reduce nicotine exposure to your baby is washing your hands, washing your face, and if you can, brush your teeth before you then cuddle your baby and also breastfeed your baby. I know it sounds like a lot. It's not a very spontaneous way to nurse your baby, but it's a way to not have to make a decision on, will I smoke and not breastfeed, or will I do this or that? So that's one of the things. Now, one other thing is important is do not smoke in the car. So that's a real no-no. So please, even if the windows are open, it does put your baby at a huge risk. Avoid bed sharing, because you can still exhale nicotine for quite some time after you have finished smoking. So it's definitely not recommended to bed share if you're a smoker. And then if your partner is a smoker as well, that's a double of the risk. So have your baby next to you in a cot, safely, with all the measures of what we need to do to reduce risk. Let them sleep on their back on a firm mattress and have a good ventilated room. And I won't go into other things right now in terms of SIDS prevention and reduction, but there are some of the issues that you need to face. So, and then other ways to deal with being a smoker and wanting to quit, but not being able to quit just yet. And let's face it, it's a difficult situation to quit smoking when you've just had a new baby, because it's a really stressful situation to be a new parent. And then to be asking something that is like stressful to you to quit smoking, unless you've already done it in your pregnancy. So, yeah. So, nicotine replacement therapy, that's what I would like to talk to you about as well. So, nicotine replacement therapy is advocated to help quit and reduce exposure of nicotine to you and your baby. And it should be used with medical advice. It reduces the risk of smoke inhalation and toxin inhalation, because, of course, when you exhale smoke from your cigarette smoking, you don't just exhale nicotine, there's other chemicals as well. So it still can interfere with normal lung development, even if you are on replacement therapy, so lung development of the baby, but it appears to be much safer. Nicotine patches have lower levels of nicotine as well. So the blood levels that were found after smoking nicotine was 44 nanograms per mil. And that was versus the nicotine replacement therapy, where the blood level was only 70 nanograms per mil. So that's quite a reduction. Nicotine patches also have lower levels of nicotine. You can choose 21 nanograms, 14 nanograms, and also 7 nanograms per mil. And so that would also mean if you use these patches, then that would be so much less nicotine in your breast milk. If you're using nicotine gums or nasal spray, breastfeed first, then chew or spray. Use it pretty much like a cigarette. Vapes are not risk-free. There is a variation in quality, and it's hard to be modified to produce higher. It can be modified to produce higher concentrations of nicotine and other toxic chemicals, which then can be inhaled and also exhaled in that vape cloud. And if you've got a vape cloud around you, then I could inhale that again, or the baby could inhale that again as well. So so vapes may not be the answer. Patches are recommended to be removed overnight to reduce the baby's exposure. And another advantage, if you like, of nicotine replacement therapy is it does not cause breast milk to smell of cigarettes, because what has actually been shown is when breast milk was investigated or some research was done on breast milk, they found that the breast milk after the parent has smoked was very much smelling like cigarettes and also tasting like cigarettes. So so that's an advantage as well if you use nicotine replacement therapy. There is good websites and support services like Quit. I haven't got the website open here for you, but you can look that up as well. And that's pretty much all I want to talk to you about today. I've got a bit of a cheat sheet here, so I'm just going to have a little bit of a peek before I finish today. I'll go back to the safe sleep guidelines because they're important for all babies, but in particular for babies who may be exposed to nicotine. So sleep the baby on the back. I've said that before. Keep head and face uncovered. Very important. So don't put a beanie or anything like on if the baby is sleeping in the cot. Keep the baby smoke-free before and after birth. Obviously, we're talking at the moment about, after the birth. Safe sleeping environment night and day. No soft surfaces and bulky bedding. So that's important as well. And again, that's not just because of smoking. That is the safe sleep guidelines that should be applied to all babies. Sleep baby in a safe cot in parent's room. So the baby really should sleep in close proximity to you, but on her or his own surface, like a cot. And obviously, breastfeeding does protect from sudden infant death syndrome, even in the presence of smoking, nicotine, or tobacco. So I think that's pretty much it. There is, here in Melbourne, the Women's Hospital, and they have a pregnancy, drug and alcohol information helpline, direct line, and they can help you also with information on tobacco smoking. I won't include any other inhalations of marijuana or anything like that tonight, so just focusing on that. And also always keep in mind that parentinggenie.com.au has got a 2 weeks free membership if you want to give us a go with a membership and have some consultations with a midwife, lactation consultant, or maternal child health nurse. Feel free to do that. And otherwise, I'll see you again next Wednesday night. Have a good night. I'm still here. Sorry. The end of this live stream button has moved.